What is a diaphragmatic hernia? A diaphragmatic hernia is a rare condition that can affect babies. The condition is generally discovered while the baby is still inside its mother's womb, thanks to an ultrasound scan, which is an image of the baby. The doctor can see on this image that there is a hole in the baby's diaphragm. The diaphragm is a muscle that allows us to breathe and which separates the lungs and heart from other organs in the abdomen, such as the liver and stomach. When the baby has a diaphragmatic hernia, the baby's organs, which should be in its abdomen, like its stomach, intestines and liver, move through the hole in the diaphragm into the thorax. They move the heart and compress it, and prevent the lungs from developing. It's a serious condition because the lungs can't expand sufficiently, and the baby won't be able to breathe by itself when it's born. Sometimes, in the most severe cases, the doctors suggest to the parents that they operate on the baby while it's still in its mother's womb. The surgery consists of putting in place and then inflating a little balloon in the baby's windpipe under ultrasound control without opening the mother's womb. The hope is that this will make the lungs grow better and increase the baby's chance of survival at birth. The little balloon is removed after 4 weeks. When the baby is born, it will immediately have a breathing tube placed to enable it to breathe, and then the baby will be cared for by the resuscitation department of the hospital. The baby is installed in the resuscitation unit. It's a place where he's surrounded by machines to monitor him, help him to breathe, feed him, and give him medication. When his condition is sufficiently stable, the baby will have a surgery. The doctors will open his abdomen to put his organs back in the correct position. Basically, they're tidying up. Then they'll close the hole in the baby's diaphragm, either by stitching the diaphragm directly, or if the hole is too large, the diaphragm will be repaired using a patch. It's important to understand that although the baby has been operated on, he isn't yet cured. Thanks to the surgery, his lungs and heart now have enough room to grow, mend themselves, and learn to do their jobs. This can take some time, and sometimes it can be quite difficult for the baby, who is still very weak. So for this reason, he will generally spend several weeks in resuscitation. It's also important to understand that not all babies are lucky enough to manage to recover from this condition. For some, the lungs are so badly affected that they will not be able to survive in spite of the surgery. It may not even be possible to operate in some cases. After the surgery, the baby will also have to learn how to breathe by himself, and that can take some time too. During this time, the parents, liaising with the medical team, can look after their child, changing his nappy, comfort care, and even carrying him. Being close is vital for both baby and parents. When he's gained enough strength and his lungs are sufficiently robust, the tube will be removed from the baby and other machines will take over to help him breathe on his own, little by little. He'll leave the resuscitation unit and be transferred to the intensive care unit. Here, he'll need to learn to breathe and feed without machines and to no longer need medication. It's sometimes quite difficult at first. If he needs help, the doctors can suggest various possibilities to the parents. Every day, the medical staff will check that the baby is growing and that everything is as it should be. This period can be difficult with ups and downs. When he's well enough, he'll move to another department in the hospital, the neonatal unit. This is the final stage before being able to go home with his parents. After a few days of checking that everything is all right and learning to be together without any machines, the doctors give permission for the baby to leave the hospital. At home, everyone needs to get their bearings at first. A nurse usually calls at the house to reassure everyone, and gradually everything returns to normal. The child will grow up like all the other children, but he's had an unusual beginning and can remain a little delicate during the early years of his life, so he'll be monitored regularly until he reaches the age of 18. And throughout this whole process, the doctors will be there to support the children and their parents so that everyone feels safe. Any other questions? The APEHDia and FEMATO websites, as well as the Reference Centre website, are very useful resources for learning more about diaphragmatic hernia.